Hello, my name's Gorna. I'm the Executive Director of the Partnership for Maternal, Newborn and Child Health. I want to tell you about some of the really exciting things that have been happening over the last month since we had our 17th board meeting in Lusaka, Zambia. The board adopted an important new strategic plan that will guide us for the next 5 years, and one of the key strategic objectives is to drive accountability. So what is accountability? Well, basically, accountability is making sure that what organisations and people say they'll do gets done. And when it doesn't get done, making sure people know about that and we can take the necessary steps to deliver on our promises. Earlier this week, the Every Woman, Every Child movement brought together over 100 experts from all over the world to a consultation on accountability that we co-sponsored with the World Health Organization. It was a really important gathering, and what we did was we looked back at the previous global strategy and how accountability worked through the MDG era. Then we talked a bit about what still needs to happen to deliver on our accountability commitments to date, and we started to plan for the future. Looking back, we celebrated the remarkable work of the Independent Expert Review Group, the IERG. At the UN General Assembly, we launched this report with them, and this report is an extraordinary compilation of everything that's happened over the last 15 years, and importantly, everything that didn't happen, the work we should have done and we didn't deliver on. It's a message to us about how we must pull together to deliver the unfinished business of the MDGs and to really achieve the goals that we've set ourselves as a global community. As well as looking back at the great work of the IERG, we also spent time this week looking at how we're going to implement one of their key recommendations, which is a new global accountability mechanism that will bring together all stakeholders in mutual accountability, making sure we hold each other to account. And one of the ways we're going to do this is that the Secretary General is going to appoint an IAP, an independent accountability panel that the partnership will support. What's really important about the IAP is that, like the IERG, it's independent. Accountability must be pure. We can't have vested interests if we're checking whether we've all done what we've said we'll do. And this IAP will develop an annual report looking at the state of women's, children's and adolescents' health and make sure we hold each other accountable for the resources. Did we spend what we said we'd do? The results. Did we actually change lives? And rights. How can we make sure we protect the rights of every woman, every child, every adolescent, everywhere? Next week I'm going to Chad, to the Regional Committee of WHO Afro. It's going to be the first meeting for the new Regional Director, Dr. Sidi Mweti, and we're expecting lots of African health ministers to discuss how they're going to respond to the many different challenges on the continent. And earlier this week we had some slightly worrying news about maternal mortality. Whilst there has been a good reduction of around 40% in the numbers of women dying in childbirth, overall the numbers have gone up. And in some countries it's a really alarming picture. Two of the highest countries are Chad and Sierra Leone. In Chad, a woman has a 1 in 18 risk of dying in childbirth during her lifetime. In Sierra Leone, it's 1 in 17. And you know, it's great news, of course, that in Sierra Leone we're now Ebola free. But the long-term consequences of that outbreak are being felt. And we see that in this increase in the maternal mortality rate. There's going to be lots discussed at WHO Afro, HIV, Ebola, health systems. I'm going because the global strategy for women's, children's and adolescents' health needs to be delivered in Africa. And there are 20 countries, including Chad and Sierra Leone, that have made commitments to do that. But there are still over 30 countries that haven't yet made those commitments. So I'll be urging their health ministers, their officials to sign up and say what they're going to do. And then all of us together, we need to hold them and hold each other to account so that the commitments that are made, the promises we make, get done and we achieve those ambitious goals together.